Hello guys, welcome back to my YouTube channel. Today I am going to explain with you mechanism of action of warfarin. Warfarin is a anticoagulant and we are using this anticoagulant in several medical condition. I would like to start my video. What are these medical condition we used to use in the warfarin? The few examples are as a treatment for DVT and the pulmonary embolism. Then we have to prescribe the warfarin for such a patient. So second example is if the patient with non-valvular AF as a prophylaxis to prevent the stroke and the thromboembolism, we have to use this warfarin. Suppose if you diagnose to have the non-valvular AF patient, then you have to put the Shattuck scoring system. Then if that particular patient Shattuck score is more than 2, then that patient is a candidate to start the warfarin, and our target PTINR is a 2 to 3 in that patient. So third example is it can we have to prescribe the patient with the cardiac valve replacement, patient who undergone for the cardiac valve replacement, that patient is also candidate to on the warfarin. So another example is a post myocardial infarction, and another example I can say is a rheumatic valvular disease. Also you have to start the warfarin and keep your that patient's blood in the thin condition. So these are the few example the warfarin is going to use in the medical as a treatment. So there are many example, but I would like to highlight in here the common condition. What are the medical issues we are going to use this warfarin? So in mechanism of, when we talk about the mechanism of action of warfarin, we have to understand the very few biochemical reaction which is happened in our body. So I would like to start with that. Our liver is forming the synthesizing the tons of protein in our body. So among that protein, very important proteins which is used in our coagulation cascade also synthesized by liver. Those are we call as factor 2 and factor 7 and factor 9 and factor 10. These factors we actually call as elementary products. So we can say it that is the precursors of factor 2, factor 7, factor 9 and factor 10. When these precursors are formed in our body, it should convert into the its inactive form of those particular factors. So this reaction won't happen alone, right? Then actually I just want to say, when these precursors of these factor 2, factor 7, factor 9, factor 10 synthesized from our liver, it should convert back into the our inactive form of factor 2, factor 7, factor 9 and factor 10. So when this inactive form of these factors are formed, these factors are utilized from the our cascade pathway, and they make in the ultimate production of fibrin, and which involve in our coagulation system, right? So for as I told you in previously, this reaction can't happen alone. It needs some another reaction which is happening in our body. When that reaction is occurring, so it will precipitate this precursors of these factors convert into inactive form. That reaction we call, when our vitamin K reduce form, it when it convert into the vitamin K epoxide, right, with the help of very special enzyme, we call this enzyme gamma glutamyl carboxylase. So same time, these precursors of factor factor 2, 7, 9, 10 convert into the its inactive form. So you have to understand here that this vitamin K reduced form, when it convert to the vitamin K epoxide, this reaction is not a one-way direction reaction. It is happening in the vice versa also. When the vitamin K epoxide concentration is going to be high, it gives us a negative feedback. Then when the excess of vitamin K epoxide once again convert back into the vitamin K reduced form with the help of another special hormone, we call that is the vitamin K epoxidase, which is uh, you know uh, facilitated this uh, reaction. So that's how our you have to understand how our precursors of factor 2, factor 7, 9 and 10 convert into its inactive form. Actually, you have to understand it can't happen alone. It has to precipitated by the another reaction. That one is a vitamin K reduced form. When it convert back to vitamin K epoxide, same as vitamin K epoxide, it convert back to vitamin K reduced form. This reaction also going to be may be facilitated. So that react so you can understand here there is a very important two enzyme which is taking the part of role in this reaction. So that one is gamma glutamic carboxylase, first one, and other one is vitamin K epoxide reductase. When we give the warfarin to a patient, it is anticoagulant. This warfarin will bind with these gamma glutamic carboxylase receptors and the vitamin K epoxide reductase receptors. So what will happen? This gamma glutamyl carboxylase and the vitamin K epoxide reductase enzyme will be inhibited. Then what will happen? As now you know, without these two enzyme, this vitamin K convert into the vitamin K epoxide also going to be inhibit. Then vitamin K epoxide convert back into the vitamin K reduced form also going to be inhibit because of lack of these two enzyme activities, right? So same time you can understand without this vitamin K reduced form converting vitamin K epoxide and reaction, these precursors of factor 2, factor 7, 9 and 10 convert into the its inactive form also going to be inhibit. Due to that reason, what will happen? That patient have the lack of inactive form of factor 2, 3, 7, 9 and 10. Then that patient coagulation cascade also going to be inhibit. Due to that reason, we can keep that patient blood in the very thin condition, so we can prevent the thromboembolism in that patient by reducing the possibility of clotting ability in that patient's blood. So that's how this warfarin is working in our body, and I hope you understand the principle of the how this warfarin is working. So if you have any question, please comment in below. uh, I hope you guys understand the mechanism of action of warfarin. If you like my video, please like and subscribe my channel. See you guys in next video. Thank you.